So I've been working with Oasis for about 2.5 years now. Prior to that, I was working for about 9 years up in Southport. So at that time, I'd sort of gotten to a place with my career where I kind of picked up this gap between like your average suburban dental practice and then these kind of centres of excellence of really bringing the best quality dental treatment to patients, offering them the widest range of dental treatments that's available to them. So I'd sort of gotten to a point in my career where I knew that that's where I wanted to head, and it just so happened around that time that Andrew was able to offer me a position here. So I think I've found what I'm looking for. When a patient comes to see me, I guess the first thing that they'll be greeted with when they come to the practice is with a medical health history form, which I know everyone's a little bit bored of doing those and they seem tedious at the time, but that's the first port of call that we focus in on, is to make sure that we've gone completely across all of your medical history. We know what medicines you're taking, we know any risk factors that we need to watch out for. We also know what treatments you've had in the past, what's worked well, what hasn't worked well, so we just like to get that whole picture first of all, and I think that's always a really good starting point, so that we're kind of both on the same page with you know, where the patient's at and where they'd like to be going. So first of all, what we look at doing is taking a series of diagnostic photos, so that way we can sit down together and I can explain sort of where we're at with the facial aesthetics. So we're looking for things like volume loss, skin laxity, we're looking for hypermobile muscle movements, any facial asymmetries that we might need to address. So we really dial down into those specifics, so that then you can understand your own face and you see what's going on. Even though you look at it every day in the mirror, sometimes you don't start to notice these things until I point them out, which isn't to make it a negative experience. It's just so that you get more familiar with your own face, and then we can see what might tweak it a little bit just to enhance it or balance it a little bit more than what it already is. So I guess after you've been practicing general dentistry for a number of years, you kind of get to this point where you're, I guess it's called unconscious competency, I believe is the term. So you know what you're doing, you don't have to be challenged too much by that. So once you get to that point, obviously then you've got to look to see what's the next thing that you want to do, what's the next challenge. And for me, I'd always had an interest in facial aesthetics. Obviously just from a personal point of view, we always think of that aging process and how best we're going to slow that down. And so I thought, why not get involved with it myself? So you start off with kind of your general courses where you'll go for 1 or 2 days and learn the basics and look into that. You can put it into practice, but I guess the stopping point for me there is that you want to know that you're offering the patients the best level of knowledge, the best treatments, so that they're in safe hands and get the best outcomes for what they're looking to achieve. So at that point, I decided that I would do a Masters of Aesthetic Medicine. So basically that's a 2-year course, and what that does is take kind of a deep dive into skin physiology, looks at injectables, cosmeceuticals, it looks at even lasers, hair removal, which isn't particularly relevant to what I'm doing. Basically, yeah, giving all the treatment options that are available in this field. So just that I've got that understanding and basically bringing the best that I can to my patients, really is what I'm after.